The last 43 days. 32 of the last 43. That's like 3 out of every 4 days just piling it on.
Yeah, that snow plus the extreme cold temperatures have kept a lot of us cooped up inside. Yeah. And we wanted to take some time to talk with Dr. Mehra from SSM Health about how to beat those winter blues, and I think everyone's feeling it this year.
That's true. It probably meant a few snow days for the kids that are in school.
Yes.
So I'm sure they were happy about it to some degree. But yeah, so, you know, there's something called seasonal affective disorder, or the winter blues, or seasonal depression. And so basically what we're talking about here is right around the time that we change our clocks. You know, when that fall season's beginning, the days are starting to get shorter, it's less and less daylight. A lot of us may feel sort of that mood change, that, wow, you know, I don't have that same joy that I have every day in the spring or summer. But what we're talking about today is a little bit more than that. It's not just having the winter blues as we call it, it's a little bit more. It's having that lethargy, the apathy, the really lack of drive with other depressive symptoms. When you start showing those signs, and about 5% of Americans will have that, really beginning in the fall, going into the winter, you have to have it for at least 2 consecutive years. What that means is you have seasonal affective disorder. There are treatments available for seasonal affective disorder, like any type of depressive disorder, and it includes things like medications, light therapy, cognitive behavioral therapy. But of course, the first thing you want to do is really recognize, is this what's happening? So of course, talk to your doctor first. We talk about other things like exercise. We always talk about obesity. Seasonal affective disorder does, of course, contribute to things like obesity. So a lot of us joke that, you know, in the fall and the winter that we pack on those extra pounds. We call it our Christmas weight or maybe our winter weight. But unfortunately, that is part of this disorder, or part of this disease process, that we do crave more carbohydrates. Now again, it's not just a day or here and there, it's we really are craving it, we're packing on the pounds, we're not having that same just joy for life. And so if you just feel sad once in a while, that's a normal response to life, right? The slings and arrows of outrageous fortune, we're going to feel those pings, but we're talking about really feeling severe symptoms here. So again, 5% of Americans, mostly women, 80% of the people that suffer from this will be women, 20% male, and 20s to 30s is really the main age here, which is somewhat surprising to many people. So if you are feeling any of those symptoms, talk to your healthcare provider, talk to your physician, say, am I possibly suffering from a form of depression? If you are, the reason that we use that light therapy is that can trigger the melatonin, the serotonin, all these different neurotransmitters in our brain, that when we get less natural sunlight, all of a sudden we feel like sleeping more, eating more, and we're really just hibernating. But unfortunately, we're functional human beings. We all have to be, you know, a part of society. So if you really are feeling that, talk to your doctor, and then we can, of course, assess, see if that's the diagnosis, and then treat you accordingly.
Oh, that is so important.
I know.
So yeah, and there is a difference between, we want to make sure, just, you know, what we would call winter blues and this very, you know, serious medical condition.
Right.
So yeah.
And so a lot of people ask, well, Dr. Mehra, what if I just have the winter blues? What can I do? Like we talked about, the exercise, trying to increase daylight, meditation. So if you notice some of those initial symptoms, start preventing it. You know, definitely talk to your doctor, even just about that.
All right.
Just got to get active. All right. Thank you, Dr. Mehra. We appreciate it. And welcome back.
Yeah. Thank you. Great to be here.
It's great to see you. So trying to shift out of that drab winter mentality, we are hoping the Packers' new